So, what we're going to go through now is generally how you should approach each station, especially if there's an actor, okay? So walk in, be positive. A good way to remember all the ground to cover is IPEEP, and I'm going to go through that for you now. Hello, I'm Dr. Townsend, nice to meet you. What's your name?
Craig.
May I ask how old you are?
I'm 32.
Good, thank you very much. Now what I need to do today is examine you. With each station, depending on what it is, you would then explain to the patient what you're actually going to do. Obviously if it's cardiovascular or respiratory, you'd ask him to take his top off. If it's lower limbs, you'd ask him to take his trousers off. So always adequately expose the patient and ask permission to do whichever examination you're going to do. Also don't forget at the end to ask them if they've got any pain anywhere, because this is very important. If you hurt a patient in the exam, you're in trouble already. And at the end of the examination, there are also more points to score, so always thank the patient. So thank you very much, Craig, for the examination, very kind. Cover the patient up, maintain their dignity, and when you've finished and you said thank you to the patient, then turn to the examiner and present the case. You've then left the patient, you finish with the patient, you turn, you say hello to the examiner and you start it. Don't forget to mention the extra things that you probably wouldn't have done in the exam. For example, any PR examination, examination of external genitalia, femoral delay, things like that. Also mention the bedside test, so if you want a peak flow, if you want an ECG done, mention those as well. And also don't forget the observations. It's always important, you want to know blood pressure, how the patient is and how stable they are. That will help get you extra points as well. And then proceed and present with your case. So as you've finished and you've done your presentation, still thank the examiner, thank the patient, it looks courteous, it looks good. As you walk out of the station, leave it behind you, forget it. However badly or however well you've done, move on to the next station, deep breath and start again. Good luck.